We want to know whether the PHA is working or it's not working, and what's his solution.
need to talk out what was the cash component that actually arrived at the facility.
Why now man Mary sleep corridor blasting hospital?
Yaman, you cannot turn a health center into and declare it for nothing into
Honorable Minister,
Central Province, it serves Gulf Province. We must put him in this context. Right, international media, local international country na expose him sigma natin.
Member for Okapa.
Thank you, Deputy Speaker. Give him time. Lomi making people Lomi Okapa asking question without notice. Mr. Deputy Speaker, my question without notice is directed to the good Minister for Health. Now there's a question I think in the social media space, planning to talk about health services from across the country. And one video will go around and you may look him, and it's a big gap, big issue across the country. So, Mr. Deputy Speaker, question blow me golo. Health Minister awesome. Every time you meet broken money blow country, put the money blow health services you go and big money you miss put him the planning debate you yet Deputy Speaker you making debate blow side blow health too. I'm making round blow stop. So Mr. Deputy Speaker, I'm saying money you may put him long and how much million national government you put him blow health space. And we go down to PHA, work lo happen so we come up on the international media report when Australian journalist interview Dr. Blomiplo, but must be General Hospital. Look him, let me ask him a professional, a medical doctor. Why now man Mary sleep corridor hospital, but must be General Hospital. Now why the medicine in the staff will treat him on? Now all this like enemy stop National Capital District. Just imagine what's happening around the country. So in our health minister, he explaining this house, the people blow. Papa, where is the problem? Money you may put him, but the system deliver milk service go yeah. One problem is that you saw this law no cut. So the provincial health authority system. You may get them walk or you get problem with this law. You get plan minister to bring blah. New plus system may come or you may go private go back to all plus system with provincial government. Running all hospital from Blanchelo provinces na it's all a district. So I'm question blow me without notice. You go to Minister. So thank you, Deputy Speaker.
Minister for Health.
Thank you, Mr. Deputy Speaker. I mean, like to take you long. We have Okapa asking him the important question, which of important public interest lo country me. First one I'm imi sabe lo la media or la video lo circulate on social media. Me la making firstly lo put him lo record also me right lo la international media lo go into lo lausik lo country na expose him sigma natin. It's against infringes on patients' rights and responsibilities. It's la time CEO lo PMG in sabe lo this land all go chat natin external video inside. But long we play item all issue imikat len. People sabe true lo one miss you imikat lo PMGH. Na imi will address him last time. Number one, PMGH the last 2 years, 2024, emikishim amlakan budget also 173 million kina. Both must be General Hospital Tasso. 2024 budget only go on top of 257 million kina. That's 2025. 2026 budget only go on top of 272.
Honorable Minister, we have a point of order. Honorable Minister, we have a point of order. Member for Aba, what's your point of order?
The point of order, the Speaker, is every time the Minister is asked about health issues, he keeps quoting budget figures. Question is not about how much. Question is, online slip lo floya. Answer the question. Budget figures, yeah. Doesn't work.
Honorable,
7 years, government is up 7 years. What are they addressing the floor sleeping of patients?
Honorable member for about order. Honorable member for about your point of order is in order in the importance of our country, but I think the minister is responding to the answer and he has a prerogative of what he respond to the answers being made. So I'll allow the minister to respond to this question. It is a very important question for our nation to know about the status of the health. Okay, let's allow the minister to respond. Minister.
Thank you, Mr. Deputy Speaker. Tisla ya, we acknowledge the talk about, but we like clearing more same. Tisla money go. Tisla ya, PMJ gives him 272 million budget now. So why? Na money go na imi look him overcrowding long emergency department. Na mama ko sleep lo floor, lo carry baby lo maternity ward lo PMJs. Emsla question me like answer him now.
We have another point of order, Minister. Governor for Isibik, what's your point of order?
Mr. Deputy Speaker, it is common knowledge that in 2024 and 2025, provinces and a lot of agencies had significant budget cuts. And for 2024, I'm step inside long final budget outcome report where health department too been some cut. So milaki minister elaborate also yes. Amount pepa you put in, but actual case iko mamas. You know good plalo you call him tasol. Because me pla planti you pla call him trabla nambalo ya.
Honorable Governor for Isibik, I will not allow you to make a statement on the question that is raised. It's a point of order. If there's anything that Minister have said it's not correct.
Talk sabe blumi emolsem. Emi no fair long emi talk only kind money stab lo budget na cash ino come out. I need to talk out what was the cash component that actually arrived at the facility. Thank you, Mr. Deputy Speaker.
Thank you. I think I've made a ruling already. I'll allow the minister to make the statement. The minister is just beginning to make and reply on the question, so allow him to make the question. We cannot put a question before him replying to the question, so allow the minister to make the question. Minister.
Mr. Deputy Speaker, PMJ at the moment is governed by Public Hospital Act 1994. In one kind of small PHS or not last country, we only covered under the PHA Act of 2007. At the moment, only got 1,291 workmen now work marry PMJs. Only got 255 positions vacant at the moment, which at the moment as I speak, only work recruitment now. You miss also. You got 17,000 mama is a current baby lo maternity ward lo PMJ. That's 60 every month, 17,000 every year. And plan it through. Now 24 plus midwives will stop lo this lab. While long NCD only got more than 300 workmen install NCD, 30 doctors stop. Now they are actually underutilized. Okay, and on something where people like they actually meeting at the moment address him how we can work one time to improve more services lab. So we know what him gonna make him. This is heavy. I come up because all system level, primary healthcare level, NCD na go good to us. Also now the Sigma go call PMJs. PMJs level 6 out of country. I mean, would say me national referral, super specialist training research hospital. You got level 1, the primary health level, level 2, and community health post, level 3 health center, level 4 district hospital, and level primary health, level 5 provincial hospitals. Level 6, you don't need to look at the line away. Mama go carry nothing lo up. Suppose look. Call all primary health level. At the moment, the Minokatsan facility, Kolokereo today, they are undergoing renovation. We're going to improve the number of bed space in our Gary hospital. Kila, you got Tom Lausik building long have now. Metoria Clinic, must be northwest, must be northeast. Metoria, only got Tom the clinic is tablo up for the first time, all mama now only go deliver up. Me appeal all mama long NCD. Non-colo PMJ Thomas, he got on the Kutla facility, stable Metoria Clinic, which actually underutilized 2 delivery beds, stable up, one the delivery, one the day. Now, if you could go have now, you see this facility to instead of the colo PMJ, that's all. PMJ, we serve also more now, or look side long, specialist areas like kidney transplants, last year, make him one. All make heart specialist now, kidney, cancer facilities, we are doing a 200 million cancer facility, the PMJs for the first time in our country. So we need to allow PMGH to actually deliver at that level while we improve the primary health level. So what we're doing at Central Province, Quikila becomes the interim hospital below Central Province. Only got 6 doctors now will establish Quikila for the first time in the history. Mr. Abao, you can go and confirm with me, but there's
Honorable
6
Minister,
doctors.
we have a point of order.
6 doctors now at Quikila.
Honorable Minister, we have a point of order. Member for Abao, what's your point of order?
Point of order, Mr. Speaker. You know, the current minister, during COVID, he declared Quikila, which was a health center status, to a provincial hospital status. And Kiamania, you cannot turn a health center into and declare it for nothing into a
Honorable Minister,
provincial
resume your
hospital.
seat. I'll make a decision
Therefore,
on this.
the minister has to make a commitment to build a hospital for Central Province people. That deal, it's never been built. Just declared
Honorable member
10
for
years
Abao,
ago.
let me
Don't talk
interrupt
about
you.
Quikila, talk about the Central Provincial
Let me
Hospital.
interrupt you, Honorable Member. Your point of order is out of order. It's not in line with what the Minister is saying. Minister, I think the Honorable Member for Okapa is asking you a question to know why we have those problems and it's not being addressed. What's your plan on that? So I think you respond to the Minister in that regard. Member for Okapa.
Speaker, Quikila, I went there, announced PHA at Quikila. Suppose even announcing Quikila or Central, Quikila becomes the interim hospital, the Central Province. We won't be able to have doctors there. Today, you got 6 doctors tablohab. I went there 3 weeks ago, maternity ward, got 6 doctors tablohab for the first time. Only got X-ray department, X-ray, pathology, only got dental, only got maternity ward. Mamas are now delivering at Quikila for the first time in the history of that place. Suppose you know got PHA lohab, but it's like something to come up to. All of these things are in place while we fix the Central Provincial Hospital. That was delayed because of a lot of reasons. Suppose me, Dr. Research by taking one old case and talking about these things. We are actually improving Kerama as well. Last week I was in Kerama. For the first time, Kerama now we got all of this. Maternity ward come up lohab. Mortuary service come up lohab. Dental, X-ray, all of these are Kerama. I acknowledge the member for Kerama and Kerama Gulf PHA for all of these things happening. PHA must be supported by the governors. All the members will salim service level agreement on the PHA will make it work. Minister of Health want the Prime Minister Namibla, the committee money, establish some health laws, standards.
Honorable Minister, we have a point of order.
Mr. Deputy Speaker, we don't want to know about all his accomplishments or purported accomplishments. We want to know whether the PHA is working or it's not working and what's his solution. Thank you.
Honorable Minister, our question time is lapsed. I will ask you to sum up your question, your reply. And as you know, Minister, this is a very important issue in regard on that. If you can sum up your reply and maybe you can make a statement in a coming session for the importance of the members of Parliament in regard to that issue. Honorable Minister.
Thank you, true, Mr. Deputy Speaker.
Honorable Minister, we have another point of order. Governor NCD, what's your point of order?
Present time we run out, so we like helping Minister. In that Minister, we explain most of POM GEN, under pressure too because it serves our capital city.
Honorable
it
Governor.
serves Central Province. It serves Gulf Province. Members put him in this context.
Honorable Governor, your point of order is out of order. Honorable Governor, receive your seat. Honorable Governor, receive your seat.
Thank you.
You know that there's nothing in the standing order that you can help another person to answer the question. So your point of order is out of order. Honorable Minister.
Thank you, Mr. Speaker. Me like me clear das all sema imi save straight law one mo levi mikat all clear policy directives clear straight KPI na mi askim this line in all interview ma golo PMGH all askim lo question all askim all same and this time also what is the future now to come back 2020 2030 or 2031 assess our health facilities again and health system in the country. We know what we're doing and we'll improve the system by 2030. Come back and check us again. Thank you, Mr. Speaker.
Honourable members, our question time has lapsed.